Hi ladies, I'm going to be talking about cervical cancer, so enjoy! It is a disease in the cervix that form malignant cancer cells in the tissues. It is known to be one of the most common causes of cancer death in the world, where pap smear tests are not readily available. And in the US and other countries where cervical screenings are routine, it is not as common. It is the easiest cancer to prevent when given regular screenings, such as a pap smear test, looks for precancerous cell change on the cervix, and an HPV test that looks for the human papillomavirus that can cause cell change. Cervical cancer is the second most common cancer among women worldwide. All women are at risk for cervical cancer, and it most often occurs greater than 30 years of age. 12,000 women in the U.S. get cervical cancer, with 4,000 of them that may die from it. The human papillomavirus is the main cause of cervical cancer, and 80% of women will be infected with the HPV, unfortunately, in their lifetime. The cervix is the lower narrow end of the uterus, commonly known as the womb. When a woman is pregnant, the cervix is where the baby grows. It connects the uterus to the vagina, also known as the birthing canal. Cervical cancer develops with the epithelial cervix cell lining the cervix canal, and it will divide uncontrollably. Therefore, a large amount of tissue formed is called a tumor. So you have the different stages. You have the normal cervix, the HPV-infected cervix, precancer cervix, and then the cancer. Cervical cancer begins in the cells of the cervix, so with time the cervical cancer will invade deep into the cervix and tissues nearby, and these cells spread by splitting away from the original tumor, will enter the lymph or blood vessels that branches out to all tissues within the body, and the cancer cells can attach to other tissues that will grow and form new tumors, damaging those tissues as well. So some of the signs and symptoms are your vaginal bleeding. Your menstrual bleeding can be longer and heavier than usual, bleeding after menopause or increased vaginal discharge, bleeding following intercourse or pelvic exam, pain during intercourse, and possibly pelvic pain. The two types are the squamous cell carcinoma, starts in the thin flat cells that line the cervix. It accounts for 95% of the invasive cervical cancers diagnosed, and the adenocarcinoma, it's in the cervical cells that make mucus and other fluids, and it accounts for the remaining 5%. So the human papillomavirus infection is the most common risk factor for cervical cancer, as mentioned before. It's mostly sexually transmitted infection in the United States. You may have possible multiple sexual partners, and sexual contact. So HPV can be easily spread through direct sexual contact from the skin and mucous membranes of the infected individual with HPV to their partner. So with the low-risk HPV, it does not cause cancer but can develop skin warts, and with a high risk, it may cause precancer or cancer to the cervix. So not having regular pap smear testing can be a risk factor. It can be more common among women who do not have regular exams and pap smear tests that can screen for those abnormal cells. And if early detection with those tests, it will allow the removal and killing of the abnormal cells to prevent cervical cancer. And you may have a family history. It could be hereditary or genetic, and then smoking, of course, will increase your risk as well. Also, with a weak immune system, it will suppress by taking any drugs, or an infection will increase your risk. Long-term birth control use is also a risk factor if you've taken it more than 5 years. However, if you stop taking it, it decreases your risk. Having several children, having more than 5 children, can increase your risk with women having the HPV infection. And you have to remember that having the HPV infection or other risk factors is not always an indicator of developing cancer, and then women can develop cervical cancer who have never had sexual activity nor have had the HPV virus. So the different stages, you have your stage 1 that starts with just it's confined to the cervix only. Your stage 2 disease is beyond the cervix but not to the pelvic wall or the lower third of the vagina. And then going over the 5-year survival rate, you have about 65% chance with stage 2. Stage 3, it does go to the pelvic wall and the lower third of the vagina, it's 35%. And then stage 4, you have 7% survival rate, and it invades the bladder, rectum, and then just metastasizes. So 3 ways it can spread: tissue, lymph, and blood vessels. And then you have your test to diagnose, which is your physical exam and your history, your pelvic exam, and then of course your pap test or pap smear. And this is the golden standard of screening. Cells are scraped from the transformation zone, otherwise known as the T-zone. It is looking for abnormal or atypical squamous cells of the cervix. The screening usually starts at age 21 or 3 years after the first sexual activity, then annually until age 30. Then at age 30, every 2 to 3 years, if normal pap smears. But if it's abnormal, results are found, a colposcopy or biopsy will be done as necessary. And then women greater than 65 years, following 3 normal pap smears and no abnormal paps in the last 10 years, you will usually be discontinued from having them. And then, of course, a hysterectomy, you won't need them. And then the other test is the human papillomavirus test. So you have your different pap smear results. You have your normal, your ASCUS, which is your atypical squamous cell of undetermined significance, and then your atypical squamous cell of high-grade significance, and then your LSIL, which is your low-grade squamous interepithelial lesion, and then your high-grade squamous interepithelial lesion. So with the abnormal results, you will have the HPV reflex testing. This is basically looking for the human papillomavirus and any abnormal samples that could potentially be a risk factor for cervical cancer. There are certain grades of the pap smear that will go towards a possible colposcopy, and a colposcopy is a direct visualization of the cervix to look for the abnormal areas on the cervix and possible biopsy if the lesions are found. So the biopsy gives the tissue diagnosis. And there are different grades of the tissue diagnosis, and we'll go over those. So the grades that I'm going to talk about, you have the cervical interepithelial neoplasia, which is your CIN, and the 3 grades of those are the mild, moderate, severe dysplasia, which is your precancerous lesion. So it depends on the results of the pap smear and the colposcopy with the biopsy if that was performed. The pap smear that shows the ASCUS with the HPV negative, you'll usually get a yearly pap smear. With the ASCUS with a positive, HPV positive, or those other areas that I had mentioned with the atypical squamous cells of high-grade significance, or the low-grade and high-grade squamous interepithelial lesions, with the HPV positive, you're more than likely going to get a colposcopy with a potential biopsy that may be performed. And if the results of those biopsies completed is a CIN, which is your cervical interepithelial neoplasia of 1, you will have a routine checkups followed with pap smear every 4 to 6 months until 3 negative pap smears happen, and then followed by every year. So if the results of the biopsy with the CIN 2 or 3, you usually have an ablation therapy or a LEAP procedure completed. It's also called a LEAP procedure. And this consists of the wire loop that has an electric current that penetrates the tissues, destroying the cells from the mouth of the cervix. So if it's went on to cancer, you have a simple hysterectomy that they may recommend, which is the removal of the body of the uterus and the cervix. And then also the radical hysterectomy. And this and the pelvic lymph node dissection, which is the removal of the entire uterus, surrounding tissue, upper part of the vagina, and then removing the lymph nodes of the cervix as well. So it shows the partial, the total, and the radical right here. And then another option is the radical trachelectomy, which is the removal of the cervix, part of the vagina, the pelvic lymph nodes, and the uterus is left in place. So the other treatments is the radiation therapy, and this is the high energy x-rays and radiation to kill the cancer cells to keep them from growing. Then you have your chemotherapy. It's the drug to kill or stop the growth of the cancer cells from dividing. And then your target therapy, it uses also drugs that will attack the cancer cells without damaging any normal cells. So the prognosis, I had mentioned before the 5-year survival rate of the different stages. It also depends on the type of stage of the cancer. Your overall health and age will play a big factor in responding to the treatments given, and if found in early stages, the cancer is treatable and the prognosis does look good. So to avoid, you want to avoid, of course, the human papillomavirus. Long-term use of contraceptive pills is another one. Definitely protective sex. Having a regular pap smear test is very important. 3 years after first vaginal intercourse or by age 21 years is recommended. You want to recommend girls to get vaccinated for the HPV with the Gardasil by age 11 or 12 or as early as 9 years old, pending the risk factors. And for those sexually active, HPV vaccine recommended for adolescents to age 26. The vaccine is less effective if they have already become sexually active, and then there is research going on if it's effective greater than 26 years of age. So as far as the OT treatments, you want to improve their endurance and strength because of the surgeries that they may be going through or have been through. Energy conservation techniques for the same reason. They may need lymphedema treatment or scar tissue massage, and then modifications such as using adaptive equipment or durable medical equipment to assist with activities of daily living or any instrumental activities of daily living. And then of course education on prevention and education on healthy diets. And then support groups, sorry. These are my references, and then I want to go over Michelle Whitlock's journey with cervical cancer.
Cervical cancer is the second most common occurring cancer in women worldwide. In fact, there's over 500,000 women diagnosed every year, and half of them die. That's a pretty scary thought. I went to my annual appointment, and the doctor did a pap smear and an HPV test, the human papilloma virus. I did not know what that virus really was until I heard the words that you were positive for high-risk HPV. And I learned that high risk made me more vulnerable for developing cancer down the road. What I wasn't prepared for was several weeks later hearing the words, "You have cervical cancer," which was caused by the HPV virus. I was devastated. I was 26. I had no children. I was not married. And the doctors wanted me to have a radical hysterectomy, which would leave me infertile. So I refused. I didn't want that. I wasn't sure I wanted kids, but I knew I wanted the option. And I found there was a new procedure called a radical trachelectomy and had the surgery in February of 2002. It was only later when I thought my life was on track. My boyfriend had just proposed, and within days I got a phone call that would shatter my world, that my cancer was back. And I remember that first phone call when she said, "You have to have a radical Stop. Don't say that word. I cannot hear it," was my reaction. But the truth was, if I wanted to live, that was what I needed to have. So within a matter of weeks, I harvested eggs, created 7 embryos, flew to Jamaica, got married barefoot on the beach, and 10 days later checked into the hospital, had a radical hysterectomy, followed by chemo and radiation. A few years after I was in remission, and I felt more comfortable that I would not have another reoccurrence, we hired a surrogate. The most amazing day of my life was when my daughter, Riley Greer, was born. I got to do what so many women don't do, which was actually watch my child come into this world and take her very first breath. I knew that my entire cancer journey had been worth it. Living through something like cancer changes your perspective, and it gives you knowledge you never would have known. And so I never want another young woman, period, to go through what I went through. I wrote my book, How I Lost My Uterus and Found My Voice, because I lost my uterus, but what I came out of it with was a voice that I can share my story so that they can learn and they can be better advocates for themselves so that they don't experience what I did.
So there you go. I hope you liked it. And that's gonna be it. Thanks, guys.